Capitol Report is a production of Senate Media Services.
The minimum wage receives maximum attention, and schools could become a greater factor in mental health intervention. We discuss in this week's Capitol Report. Hello, everybody, and thank you for tuning in to this week's Capitol Report. I'm Julie Bartkey. Senator Kathy Sheran and this group announced legislation that would help provide better tools and training for early intervention and identification of mental health issues.
I think it's important to say that our failure to target our initiatives, whether it's these or others that will be presented in the legislature, our failure to target those initiatives towards the factors that lead to and contribute to violence, make us complicit in the tragedies. We are complicit in the tragedies that have affected our communities. And that's the central underlying belief system that I have, that it is irresponsible and creates complicity if we do not act in the legislature in multiple ways. And we therefore are participating in the outcome of this, which is family members losing family members, and creating fear in our parents and children for their own safety. So these initiatives take steps to prevent the progression of violence, the kind of violence that can lead to, that can occur as a result of a progression of mental illness.
If you would talk to high school counselors, middle school counselors, they say mental health issues, excuse me, mental health issues are really on the rise in our schools. Currently, only about 17% of our schools have mental health professionals in them. At one time, when I was principal at Rosemont High School, we had a grant that was very helpful. So about 4 years in a row, we were able to have mental health professionals work in our building. And it's not only the mental health professionals that you have in your building that are working directly with students, but when you have problems within the family, when you have a death of a parent, when you have a death of a student, that affects everyone within that school community. And being able to have professionals there to deal with those issues, to work with students, to work with families is really critical.
In terms of the development, psychological and chemical development of the brain, and the problem-solving capacity of adolescents because of their age, the options, what they see, first of all, they can't see into the future. They have not enough background or history to anticipate that things are going to get better. So they're high risk for suicide and they're high risk for violence because they don't see other options and possibilities for them in the future. So in context of talking about interventions with guns, interventions with early intervention for mental illness, we also have to talk about what we're doing in our society as voyeurs of violence, and also what we are not doing in order to address environmental factors in our schools that create this sense of hopelessness in young people.
You know, if you have cancer, they don't say to you, come back when you're stage 4 and we'll help. They intervene right away. When you have a psychotic illness, they say, wait until you've failed numerous times. You've got to be hospitalized or have been in jail, all those kinds of things before we'll provide you a little bit of service. And so what we need to do is turn that around. And so the moment that someone experiences their first psychotic episode, we really need to be providing the most intensive treatment that we have so the trajectory of their lives is a positive one.
The connection between mental health issues and violence is becoming increasingly prevalent in the state and in the nation. Currently, there are dozens of gun proposals making their way through the Minnesota House and Senate. Senator Kathy Sheran proposed legislation that works on the mental health portion of the equation. Senator, thanks for joining us to talk about your legislation.
Oh, thank you for inviting me.
You know, let's begin with, I think it's safe to assume that with this latest shooting in Oakdale, where an innocent child was killed by what appears to be a random shooter, people are just becoming very impatient for something to be done. So how do you think your legislation can help prevent such tragedies?
Well, first I have to say that we want to be very careful not to assign responsibility for gun violence to the mentally ill community. The number of persons who become violent that suffer from mental illness disorders is not any greater among the mentally ill than it is the general population. But there are incidences in which there are persons who struggle with various forms of mental illness for a long period of time that have been found to be involved in some of these horrific incidences. And what we also discover is that families and communities have been aware of these struggles that an individual has had for a long time, but have found it very frustrating to be able to find the resources in the community to help the families address those problems. So it's to that extent that this horrific increase in gun violence has created an opportunity for us to talk about what we can do on the side of prevention, if we can have early intervention in the care of young people and support for their families in dealing with emerging symptoms of mental illness.
And according to the Minnesota Department of Human Services, statewide, 9% of school-aged children and 5% of preschool children have serious emotional disturbances. Currently, a program that your bill would help fund, it serves 17% of all schools in Minnesota. And you predicted that the figure could rise to 37% if your measure were to become law. Is this enough? Is this a high enough bar in your opinion?
Oh, absolutely not. It's not a high enough bar. It is an incremental step to increase the resources that are available to families and children who we can identify early symptoms of mental illness. Many young people have some of these symptoms emerging before they're 13 years old. And we do not have the resources available to help those families, especially if they're uninsured or underinsured. So one of the components of my proposal, which is a broad proposal and confronts many issues in the children's mental health system, provides for a school-linked mental health program, provides a contract with providers of mental health services that know how to work with young children, to go into the schools and serve populations of teachers and consult with those organizations and with families and provide services for children in the school when those early symptoms begin to emerge. I'd like to see this occur in every school in the state. And that, of course, would have a huge fiscal note associated with it. So what we are doing is taking a project, especially the school-linked mental health project, that's already in place in some parts of the state, that already is showing absolutely positive outcomes, and expanding it and growing it this year.
Okay, excuse me. And Senator Rosen, we speak to her a little bit later in the show. She argues, she of course supports the initiative as well and would like to see even more money allocated if it were possible. However, she brought up the point that there just needs to be greater accountability with the dollars that are being sent out to these programs. Would you agree that maybe the accountability measures could be strengthened, or do you think that what's in place is good?
Well, I always believe in accountability when you take people's tax dollars and implement them into a program, that we have as a part of it a measure of what the outcome is. If the goal is to reduce the progression of mental illness, if the goal is, then we have to have some capacity to measure whether or not that early intervention in fact reduces the increased incidence of more severe symptoms of mental illness in that individual's life. And that's the measure that we will want to be looking at. Of course, those kinds of longitudinal research studies that help us determine what the progress is and how it is that we can measure whether the early intervention helped also has a cost associated with it.
Okay, Senator Sheran, we're almost out of time, so I need to switch topics real quickly. Your bill to expand medical assistance will be debated soon. Now, at this time, in the short term, the state saves money by transferring a lot of people into the federally run program. Now, are you confident that the federal government can fulfill its financial obligations to the state?
This has been a topic of conversation, and it amuses me. It amuses me, and I hope it amuses people who watch this, because the state is probably the biggest agency that withdraws support from local governments and forces them to have to pay for services on property taxes. But we are offered a partnership with the federal government, and I do not understand why anticipated fear that at some point in the future the federal government may change its position, that we wouldn't enter into the partnership now. There's nothing that stops us from withdrawing from this partnership or trying to come up with alternative solutions for how to support this population if the federal government is unable to meet its obligations. But we certainly will be able to take advantage of this program, and should, because it saves us in our state's budget, as long as the federal government is able to be a willing participant. There are other situations with the federal government, like the mandate that is sent to the schools for providing for special education. The difference is that's a mandate, so it's required schools to pay for a program at the local level that was promised to be funded at the federal level. But the Medicaid expansion is not a mandate, so we're not required to continue to support it if the federal government changes its position. So the choice is, do you want to refuse the dollars as long as they are available to us because you're afraid they might go away sometime in the future? Or do you want to participate now, take advantage of this partnership, and then deal with whatever issues emerge later on?
Senator Kathy Sheran, we certainly appreciate your perspective on both of these pieces of legislation. Thank you so much for joining us.
And thank you for having me here.
Early in session, the Senate brought forth its first 4 bills it planned to introduce, including Senator Chris Eaton's proposal to increase the state's minimum wage by 25 cents an hour. On Wednesday, Senator David Tomassoni upped that ante. He was joined by Representative Melissa Hortman to outline legislation that would bring the minimum wage to $9.50 an hour.
There are 3 main provisions to the Family Economic Security Act. Number 1, it increases the minimum wage to $9.50. Number 2, it funds our child care assistance program so that people that are eligible for child care can get child care. No more waiting lists. And thirdly, it has some family-friendly tax credits. Using both the existing working family credit, we're enhancing that, and also creating a new per-child tax credit that piggybacks on the federal tax code to acknowledge the cost of raising children.
What's sad in Minnesota is a lot of the poor people are working, and they're working long hours, but their pay is very low, and that contributes to why they're in poverty. So the bill importantly supports work. It, by raising the minimum wage, encourages families to continue working to try to escape poverty, but it also makes it more possible for them to support their families on the incomes that they're bringing home.
Minimum wage hasn't been raised in Minnesota since 2005, and it's still below the federal level. And as we all know, a minimum wage increase is good for the whole economy, because more money in workers' pockets means more money for businesses, which helps all Minnesotans.
Here to continue the conversation on mental health issues and also about the expansion of medical assistance, we have Senator Julie Rosen. Thanks for joining us today,
Thank you,
Senator.
Julie. You bet.
I want to begin with the expansion of MA, and the concerns really coming out of committee have mostly been about the federal government living up to its end of the financial bargain in the long term. So does this concern you, and where do you think how do you think the state should proceed?
Well, absolutely, it's a concern, and of course there is a tremendous amount of support from the businesses and from doctors and hospitals, but the reality is that we have to make the federal government accountable, and they haven't been with special education. That was implemented with the Individuals for Disability Act in the 1970s, where they said they were going to basically fund 40% of special education, and I believe right now the average is around a little over 16% that they're giving to the states. So that's a huge difference that we have to make up, and we have all these regulations and mandates that are intertwined with state law, and it's very difficult to back down and loosen up some of that to make it more manageable.
So how do you try to make the federal government accountable, hold them accountable for something like this?
Well, that's the problem, and I think that's what goes back to this expansion. It's a wonderful idea. I think it's good. However, are we going to be able to count on them in 2020 when we're supposed to be taking care of 10% of the cost for this expansion for MA?
And so if not, does the state kind of have a contingency plan, a plan B, to maybe have some money set aside in case the federal government does not follow through?
Well, that's the problem too. We tried to get some contingency plans on the bill, and we were unsuccessful at doing this. The bill was rushed through very, very quickly without being able to negotiate some of these contingency plans that I think are very, very important.
You have one more time. As we tape this segment, it has not reached the Senate floor yet. So how do you intend to try to navigate and try to get an amendment on it?
I don't know if there's a difference between the Senate and the House bill, and if that will be going to conference committee. I don't think there is a difference, so I think it's going straight to the floor.
Okay. Well, Senator, let's switch topics here to mental health and the issue of trying to get some early intervention and early identification of mental health issues with children in particular. Senator Kathy Sheran introduced a bill that would provide $10 million to target early intervention and identification. It's fair to say that this issue is supported by everybody, but in your opinion, can the state afford this?
Oh, absolutely. I think we have to start making mental health a priority. However, back in '07, Governor Pawlenty had a priority of $34 million to mental health issues, and that included the School Link grants that Senator Sheran is the author on, that included children's mental health and some case management grants. And the thing with mental health is we need to make sure that there's some accountability that goes along with it. Everybody should, especially with the gun debate that's at the Capitol and the whole issue of mental health there, we have to make sure that whatever money we do invest, there is some accountability measures and that it's being used properly, whether it's going to the county, it's going to the schools, it's going to the cities, our public health, and that we're not duplicating processes and just increasing administration costs. That's the big fear, but absolutely, if we get this right, I'm very excited about it. I always say in both Senator Sheran and Senator Lori's committee that we should get the big white board and put mental health on the top, or aging services, or something like that when we're dealing with these programs and all the funding streams that are coming through, and figure out, are we using these dollars the best way possible, and what are some of the other duplicative programs out there that we can combine and make a better program.
If you said former Governor Pawlenty advocated for $34 million, Governor Dayton is actually proposing less than Senator Sheran's $10 million. What would you advocate for? Do you think more money should be spent if these accountability measures are put in place?
I'm not sure exactly what the dollar total is in Governor Dayton's budget. That might be just for one portion of his proposal. But again, we do have a system that's already in place. And as I said, I think we need to build on that system and make sure that we are using the dollars the best possible way and not, again, just expanding the department. And that's the big fear.
So overall, as a member of the minority on the HHS committee in the Senate, the lead minority member, do you come into this kind of weighing each measure individually by its individual merit, or do you kind of hold to the mantra of let's not spend any more money, we don't have any more money?
Well, no, and I still feel we can live within our means, and the budget is pregnant. It's very, very large. However, Health and Human Services is a different animal, a different beast, and you do have to look at the silos. You can't just say no increase to long-term care. Long-term care hasn't received an increase in years, and they absolutely are on a critical point right now where you will see nursing homes close, you'll see big changes to the home and community-based services if we don't try to infuse some money into them, a COLA increase, and release some of these mandates that they have. So I'm a big fan of not, again, increasing the department's administrative. There's I think 43 new FTEs in the governor's bill right now, or budget for human services. I think we can do better than that. I'd rather see that money go to the programs out in the state and make sure, again, we use the big white board to figure out where all this money is going and if we have duplication.
Okay, Senator Julie Rosen, with those words, thanks for joining us.
Thank you so much, Julie.
Dozens came to testify to this Senate committee in support of a bill that would create a state grant program dedicating $4 million each year to spinal cord and traumatic brain injury research. Dubbed the Jablonski-Roderick bill, it would funnel money into research to help those affected by the injuries.
There is a tension that exists in my community, a community that I've become more and more of an advocate for, and that tension is care versus cure. Particularly in the spinal cord injury community. There's a organization in the state, the Spinal Cord Society, which their logo is cure, not care, with an X through a wheelchair. Very somewhat aggressive image in the face of another side of that community, which is focused on care, which is to change the perception that the able-bodied community has of the disabled community, as if it were lesser valued or different on the inside, despite the state of the body.
I want to be cured. I don't want to be cared for anymore. I want to be cured. Thank you.
A few years ago, Senator Sandy Pappas authored legislation called the Safe Harbors Bill. Recently, she introduced a proposal that would expand on that current law. The senator joins me now to talk a little bit about her proposal. Senator Pappas, thanks for joining me.
Thanks. I'm happy to be back.
And let's begin with how does this legislation build on what you did author 2 years ago?
Well, I could go back even farther than that, because for the past 8 years, we've been really working on fixing the statutes so that the offense of trafficking is properly defined in our statutes, and it's a prosecutorial, it's easier for the prosecutors to prosecute, basically, the offense, because if it doesn't fall in the right statute, it's more difficult for them.
The offense of sex trafficking.
Sex trafficking, all that legalese stuff. So we worked a lot on doing that. But the Advocates for Human Rights a few years ago did a more comprehensive study on what the needs are. And so now we're trying to go back and look at what the needs are. So the main thing we did with the Safe Harbor legislation is we said, no questions asked. Anybody under 16 is a victim. This is not a lifestyle choice or a job choice or anything. These are sexually exploited children. You know, the average age of entrance into prostitution is 13. No 13-year-old girl says, I want to grow up and be a prostitute when I grow up. So they are exploited. We originally wanted it to be under 17, and that was a compromise that was made in the legislation. So now we're going to move the age to 17. There's no magical difference between a 15-year-old and a 16-year-old. So that's the main criminal justice change we're making. But the bill is really much more comprehensive because there's a lot more needs that victims have.
Right, and touching upon that, in the press conference, you talked about comprehensive victim services, things that could help people get out of that lifestyle and stay out of that lifestyle. So how do you envision all of these different services working together?
The most immediate need that these young girls have is to be safe. And a traditional foster home, it's too easy for them to be enticed to leave the home by their trafficker. Or if they're locked in juvenile hall, that doesn't seem fair to do that to a victim. So a secure, safe shelter for them to stay in is paramount. And then housing, because some of these young girls, the problem was at home, which is why they became homeless, they became vulnerable to becoming traffic victims. So they need a housing option. And then they need therapeutic services because, you know, the impact on them mentally, emotionally, physically, you know, they need to have really services. So those are some of the things we're looking at.
So what made you pursue this legislation? Why did you decide to do it?
Well, I've been interested in this issue. It goes back to reports that have been done in other countries like Israel and national work that's been done that first got me interested. And then I started working with local groups. There were nuns at the Catholic Church that were involved. There was advocacy groups like Breaking Free that were involved. And they approached me, and also students that were concerned about this issue. So that's how I became involved. But most recently, Julie, I found out that there actually was trafficking going on in the hotel that's connected to my apartment building by Skyway. It's the downtown, it's called the Downtown Hilton Garden Inn. And just recently, last fall, a young runaway from Iowa, she's 17, managed to get to a phone and called 911 and said, I'm being held here against my will. I think they're going to kill me. And the police rushed to rescue her. She was rescued, but in the meantime, she had been forced to service 30 different men in the course of a week. So my lesson here is that this is going on next door to where we live. This could be in the basement of the rental housing down the block. This can be at the hotel or the motel in your neighborhood. So it's not something that just is happening to international women who are held against their will without their passports. It's happening to our local little girls.
And Senator, it's safe to say that nobody's going to openly oppose this legislation or this idea. Yet it was stated in the press conference that it won't be easy and it won't be inexpensive. So what kind of price tag do you think will be attached to this? And
we're actually looking at millions of dollars here, because if you're talking about creating housing, you're talking about providing services, we're talking about hiring outreach workers that can go find a lot of these young women are homeless, that can find them and put them in a safe position. We're also talking about a training fund for police officers and for frontline service people like in hospitals or clinics, so they can recognize the signs of this is somebody who's being controlled and held against their will.
So are you anticipating a lot of pushback given given the price tag?
Well, because we haven't had money to address a lot of human service needs over the last 6 or 8 years, there's a lot of people who are coming to the legislature asking for money. And there is some overlap. There's a request for $8 million for homeless youth, and there certainly is overlap there. But I'm sure the committees will work it out. And I'm just very hopeful that when people hear about these horrific stories, that they'll be very sympathetic.
So, Senator Pappas, finally, it was emphasized in that press conference that this is going to be nation-leading if it indeed passes. So, from your standpoint, then, is it easier or harder to craft legislation knowing that people are watching?
Oh, I hadn't really thought about that. That's a really good question. I don't think it's any harder. I think it's exciting, actually, to be nation leading, and that Minnesota has in many, many areas over the last 20 years been nation leading, and we were slipping a little bit in that area. So it's nice to hear that's back in the Minnesota corner again.
Okay, Senator Sandy Pappas, thanks for talking about your legislation. We appreciate it.
You're welcome.
We won! Students from across the state gathered on the Capitol steps, showing support for Governor Mark Dayton. He has pledged more than $240 million in additional higher ed funding in his budget plan.
My generation, and I'm feel very, very badly to be part of it, even though I don't agree with it, is telling you, get an education, get all this debt, and then go to work to build our country and make our progress we need. And, we're putting you in a terribly unfair position, and we should be doing something about it. Some people say, well, we can't afford to spend more for higher education. I say we can't afford not to spend more for higher education. We can't afford.
On the one hand, we tell you, you've got to have a post-secondary education in order to have the future that both Minnesota demands of the future workforce and that we know you want. And then on the other hand, we put obstacles in your way, like overburdening you with tuition that you can't possibly pay, and telling you that you want to have the kind of future where you get a car, you're going to buy a house, you're going to have a family, and yet you can't afford to pay back your tuition debt. And so we don't have all the answers, but I want you to know that we have a deep and profound commitment to make sure tuition is no longer unaffordable, and to make sure that the debt level that you hold is a debt level that you can responsibly maintain.
Our short-term goals, which can make an immediate impact on all of you, number one, we want to address the issue of textbooks. We want to look at open source textbooks. That's something that we're working on, taking a strong look at this year. We want to make sure that there are internship opportunities for all of you here in the metro area and in greater Minnesota. And perhaps most importantly, we want to make sure that there are jobs right here in Minnesota when you graduate.
We got high demand programs across the state, and in many places not enough seats to serve the students that want to be served, and we ask the people of Minnesota to help us invest in those high demand programs.
That concludes this week's program. From all of us at Senate Media Services, I'm Julie Bartkey. Thank you for watching.